and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Back in 2020, COVID-19 was the emergency of the world. Now the emergency phase is over, but according to the World Health Organization, the virus continues to spread and endanger people's lives, particularly those who are older, have chronic diseases, are immunocompromised, or pregnant. The Apex Health body says, furthermore, that safe and effective vaccines help ensure that COVID-19 does not result in severe disease and death. In 2021 alone, COVID-19 vaccines saved an estimated 14.4 million lives worldwide, according to WHO. Vaccines are known to reduce the likelihood of new variants from emerging, and that's all vaccines. Joining me on the program is Virologist and Executive Director, Global Health and Infectious Diseases Control Institute, Nasarawa State University, KEFI. He's joining from Abuja, Dr. Akiala Ishaku. You are welcome to the show.
Thank you, Mary, for having me. Good afternoon, Nigerians.
I think I should start by asking you, do we still have COVID-19 in Nigeria? And are we having new infections of COVID-19 in Nigeria?
So, Mary, I want to say that we still have COVID cases in Nigeria. You will, within the week, a family contacted me. The husband and the wife reached out to me to say that it seems as if they have COVID and their children also have COVID, because they tend to present the same signs and symptoms of the first experiences they had when they had COVID. And so I advise them to actually keep away from the public and isolate themselves. And we are so inquisitive to know actually whether it was COVID or not. We delivered a rapid diagnostic kit for them, for the whole family of 6, and they all tested positive. So wow. COVID is still with us. You will remember that the expatriates, people that were deported from United Arab Emirates, when they landed in Nigeria, they are about 190 something. The country, to prevent the public health, community citizenship, they have to undergo COVID tests. I'm not in tune or aware of the outcome of the result, but the NCDC was saddled with that responsibility to test all of them. My aged mom called me yesterday that she had a flu-like symptoms of COVID. I delivered a rapid diagnostic kit to a brother because I was far away, and she was tested positive to COVID. COVID has been with us. You will also agree with me that Joe Biden had an erratic, interrupted campaign because he also tested positive. So
that's correct.
COVID has been with us.
And there are new infections of COVID.
Will still be with us in the... Yes.
All right. So
there are new infections of COVID.
What is the protocol now of treating COVID-19? Because it seems like it has changed a bit from 2020. Absolutely. So you find out that when you have COVID before, in the early period when we had the pandemic, you will be isolated. You will be kept in an isolation center, and then a treatment regimen will be administered to you. And after a certain period of time, samples will be collected to be sure that you are tested negative before you are released back into the community. But as time goes on, protocol changed. A lot of countries relaxed their protocol for international travels. The issues of home treatment came into existence. So we had a paradigm shift from having people being kept in isolation center to people being treated in their homes. And so what is obtainable now is that COVID can be treated through home treatment regimen services.
You remember during COVID, treatment kits were delivered at homes for people that tested positive. So no need to take people now into isolation center, but in chronic cases, people can be taken to isolation center. Maybe one of the problems we have as a country when international communities relax their protocol is that we did not have this sustainability plan to actually strengthen our healthcare system beyond post-COVID. My expectation is that most of our isolation ward would have maintained them and also convert them to other treatment centers. We now have outbreaks of Lassa fever. We now have outbreaks of cholera. So we would have repurposed those isolation centers to the health emergencies that we have now. We would have also repurposed our testing platforms, whether be it private or public laboratories, molecular laboratories, to test for more pathogens of public health concerns that are of public health security threats to us as a nation. So we never had a sustainability plan. If we had a sustainability plan when we had Ebola in 2014, COVID wouldn't have taken us by surprise. We would have been prepared for COVID and then also be prepared for future pandemics. So the country needs to reject its strategy. We need to have a paradigm shift from responding to actually preventing a lot of diseases. So we need to have indices in our budget for preparedness beyond response and go into prevention.
Let me ask you
we don't
this.
allow the disease to...
Let me ask you this. Concerning COVID, can we say it has become less dangerous than before? Would it be ridiculous to say, for example, that COVID-19 could kill somebody the way it would be far-fetched to say a cold would kill somebody?
Yeah, so Mary, we are not doing mortality surveillance. We are not doing causes of death associated with COVID. You know that a lot of people died because of comorbidities. I like the way you started with your introduction, that for people that are immunocompromised, people that are pregnant, they tend to have more case fatality rate within those cohorts and within those groups. So we don't do mortality surveillance. We don't attribute cost of death associated with either COVID or with either emerging and re-emerging pathogens or infections that are within us. And we don't also report. So people felt, there are a lot of myths and a lot of fake news, a lot of misinformation, infodemics around COVID. People thought maybe it was a disease, a political disease that was introduced into the world. Some people have a school of thought that a conspiracy theory that just to remove Donald Trump. Some people say no, it was introduced into the world to reduce the population of Africa. Some people thought maybe so there are a lot of school of thought around COVID. Some people say it is even a political disease. And so COVID is still with us. I still have people that come down with signs and symptoms of COVID. Now, but the good news is that from your preamble and your introduction, you made mention of vaccines, how it has saved over 14-point-something million people. In all honesty, the introduction of vaccine was one of the greatest WHO public health policy that we have adopted in the 21st century. So we have, vaccine has also prevented new diseases. It has decreased hospitalization rate. It has also decreased transmission rate. You will also agree with me that beyond taking vaccines, we also had the herd immunity. A lot of us had COVID, but we never came down with COVID, but our body immune system developed some immune cells, some resistance
so you believe,
to COVID. And so...
just a minute, doctor. Do you actually believe we attained herd immunity in Nigeria?
Of course, there is herd immunity towards COVID. It is sciences. It is sciences. It's not It's not it's sciences. Once there is an infection, a pandemic like COVID, people develop herd immunity. People develop herd immunity towards tuberculosis. There are people that have not taken vaccines for tuberculosis, but they don't come down with tuberculosis because of the herd immunity. A lot of people develop herd immunity towards meningitis, towards diphtheria. Herd immunity is a concept in immunology that helps us to our body to develop a first line of defense upon subsequent encounter with the same pathogens. So we have what is referred to as the memory cells that is being developed. We need to also do, and that's why post-COVID, we thought maybe as scientists, as researchers within the country would have be releasing results, research, empirical evidence-based researches to actually show the establishment of herd immunity.
Okay, so this will interest you.
You will know that we just administered.
This will interest you then. As you mentioned, President Biden was just diagnosed with a new COVID infection. This is the third time he's getting it in 2 years, and he's 81. Does that mean that America has no herd immunity? One. And two, what does this say about COVID?
Americans have herd immunity. This is because herd immunity is not long-lasting. It doesn't last for a lifetime. And that's why you have doses of vaccines. You have the first dose, you have the second dose, you have the third dose, you have the booster dose. For example, in cases of hepatitis B vaccines, you don't only take one shot of the vaccines, you take first, second, and third doses of the vaccines. And let me paint a scenario for you to actually, our listeners and viewers should actually get grasp of what we are saying. I was privileged to be out of this country for my postgraduate program in 2015. And they asked me whether I took a yellow fever vaccine and a hepatitis B vaccine. I told them yes. They did not stop there. They collected my sample, blood sample. They actually checked the thresholds of the antibodies towards hepatitis B and yellow fever. And they actually confirmed that my body immune system has not secreted the required amount of antibodies, because the nature of the pathogens that I will be working with, and also the kind of labs that I will be engaging in terms of my laboratory assay. So they recommended for a booster dose. I did not start my laboratory bench work on time. I have to wait for 3 months. They have to give me a shot of a yellow fever vaccine and also a shot of a hepatitis vaccine. And they waited for 3 months to be sure that my body has mounted immunity, antibodies that can be able to withstand future engagement or encounter with either yellow fever virus or hepatitis B virus. Those are artificial. You can activate immunity through vaccines. Now, you can also activate immunity naturally if an individual has an encounter with a disease. Now, I took the vaccine in Nigeria, but the immune response was not within a threshold that my body can be able to fight the disease. For COVID, there are people that have short immune memories for COVID, and that's why there are cases of reinfection. There are people that have long-term memories. So it also depends on the genetic makeup of an individual, and also an individual immunological status. And that's why we need to do a lot of work in Africa to establish that. I've read a lot of literatures that establish that Africans of black population and Caucasians tend to have lasting immunity towards COVID than the whites. This is because of genetic makeup and genetic polymorphism. So the understanding that Joe Biden, the president of America, had reinfection 3 times within 2 years, also confirmed my position that immunity towards COVID is not a long-lasting one.
Okay, Doctor,
it depends on an individual immunological
we really need to go on a break.
Also genetic makeup.
We need to go on a break. After that, we'll continue this conversation. Please stay with us as we go on a short break. Welcome back. We're revisiting COVID-19 on Health Matters on Channels Television. If you have questions on the subject, you can call 0808-054-2233. You can also send a message on X at CTV_Mary A or email to moalale@channelstv.com while the conversation on COVID-19 continues. So, Dr. Ishaku, a group of new strains known as the flirt variants, and which are subvariants of Omicron, and the LB1 have emerged in the US, and they came out just in June. Can you tell us something more about these strains? And if we're having new strains in Nigeria?
Yes. Yeah, so I'm not in a position to establish whether we have new strains in Nigeria because actually we have not done a lot of genomics surveillance in recent times to actually establish. So I know that Professor Happy of Redeemer University, Ede, is doing a lot of work around that. But of recent, I was not able to lay my hands on the current, genomic epidemiology or genetic epidemiology of COVID, any result that has been released. But by and large, I was able to read literatures in Nature and in Science about the new variants of Omicron in the US. It's all about health system strengthening. When COVID came, it really established it. A lot of them build up their health system. A lot of them also saw where there were gaps and they were able to close it. And so there is an ongoing genetic epidemiology, genomic epidemiology of COVID, even in the US, part of Europe, and also part of South America and in the United Kingdom. So I was also reading this literature about 5 days ago. Now, the B1 subvariant of the Omicron that was discovered in the US does not potentially have high transmissibility probability like the first B1.1.2 that was discovered much more earlier during the pandemic. And that was why there was no any media hype around it. And that was why there was no any public health concern about restrictions to international travels. And that's why there were other nations who were not placed on public health alerts for people to actually cross border into their countries. And so the virulence ability of these variants that has been established in the United States of America is not as the one that was initially detected. So,
well, that is a relief.
We have had a lot of
that is a relief.
We have had a lot of people that we have had a lot of people that have traveled into the US within the weeks, within the months, and they came into the country. Samples were not collected, and they have mingled with us already. Mary, I don't know, maybe a lot of them have interacted with you. And so if we are going to do a contact tracing, you should also be part of the lines of people that we needed to contact trace.
Let's quickly take this phone call, Doctor. Sorry to cut in. We will continue this, but somebody is on the line from Port Harcourt. Hello.
Okay, good afternoon. Interesting that you're taking this matter, but I'm taking it back. Is still around. So do we go back to the same measures of wearing masks, aggressively washing our hands again with sanitizers, and going through the test all over again? Or what is it about this? And then the other part that you talked about, the suspicion that this is a laboratory or some political disease that is being reinvented, especially when you look at the videos played about Bill Gates and others preparing a vacuum for oxygen tank for themselves and all that. What is it about this ailment and organism that they cannot get a proper vaccine to tackle with all the billions of dollars spent around the world?
Thank you so much for that. That is a very good question. So, Doctor, can you tackle this What is it about this disease that they can't just find one vaccine that will take care of it? And he says he's taken aback by all this talk about variants of COVID and all that. What's your take on that? And also he's asking, do we go back to those same measures, mask wearing, vigorous hand washing, using of sanitizers? But before you tackle that, I make bold to say that mask wearing started before COVID and stops other things. But you go ahead.
Mary, if you are privileged to be, that was a very valid question from my brother there, over there from Port Harcourt. If you travel to Japan for over 30, 40, 50 years, they have been wearing masks. If you travel to other nations, you will discover that the non-pharmaceutical measures are kept in place even before COVID. When COVID came, we introduced non-pharmaceutical measures that would have helped us to mitigate other diseases like cholera, not only COVID, like Lassa fever, not only COVID, like meningitis, not only COVID, like diphtheria, not only COVID. We abandoned all those non-pharmaceutical measures. You hardly see people using hand sanitizers now. You hardly see people observing social distancing now. In fact, a lot of older people around me, I still buy masks for them. I still give them masks as a gift because age is a vulnerable, associated risk factors, not only to COVID, but to any airborne diseases. So I agree with him. We need to fall back. My expectation is that in our banks, in our schools, in our worship places, in public gatherings, we should be able to adhere to the non-pharmaceutical measures. It is quite key. It's not only limited to COVID, but to other infectious diseases. We wouldn't have been talking about cholera now if we handle all those non-pharmaceutical measures. And back to his question, why is it that we cannot be able to handle this disease once and for all? Viruses are not like other microbial cells that have only one strain or one variant. The moment there is a change in weather, the moment they change host, the moment they interact with the environment, they mutate, they change their genetic makeup to suit.
And it's on that note, Doctor, that I have to call an end to the program. At least you made the point, but we really need to go. But that was so informative coming from you. Thank you so much for coming on the program. It was our pleasure to be your host.
Thank you for having.
And thank you, viewers,
for having me.
For being here. Have a wonderful day. I am Mary Alale Yusuf.